Hello out there, my name is Nico Gagelmann from Hamburg, Germany, and together with Claire Horgan, my co-chair from the EBMT Training Committee, we are happy to present to you the first trainee session of this year's CAR-T meeting.
We were really pleased because the combined meeting between the EBMT and EHA gave us an opportunity to collaborate with our colleagues at Young EHA, given that we both share the same vision of wanting to make training resources and education more widely available and helpful for trainees. We got together and started brainstorming what sort of trainee-focused content we could include in such a session. And I think we thought it was good to give people a broader overview about CAR-T therapy, hence why we decided to start with the science and then move on to some of the data and then the complications. So Professor Hudecek starts the session with his presentation, explaining more about the science, a bit of the CAR-T cell history, how they were developed, how they've evolved, and then goes on to discuss some pioneering new developments within the field of CAR-T cells and how the technique is being extrapolated to treat things including such as invasive fungal infections and cardiac fibrosis. We then move on to Anna Sureda, simplifying the real world data, which is a bit of a jungle out there when you go and try and actually find results which are relevant to the patient in front of you. And she really highlights, by and large, how the real world data that we are seeing more and more of as CAR-T becomes a more available therapy does seem to reflect figures that we're seeing in the published trials. And then we conclude the session with something that's essential for trainees, really, and highlighting the challenge. Roberta de Blasi highlights the challenges in looking after these patients and practical steps for dealing with the several complications that can arise. She uses a case to talk through the timing and thinking behind different complications, such as CRS and ICANS. She talks about how these should be scored and how the severity reflects the management strategies that we should use. She also talks about things such as infection and how, despite the fact that CAR-T is a complicated therapy, we shouldn't forget the basic things when looking after our patients. I think, and beyond the trainee session of the meeting, we're excited to learn more about the latest research developments in CAR-T. As I've mentioned, Professor Hudecek discusses some of the ways in which the technique is being extrapolated to treat things other than hematological malignancies. And also within the field of hematological malignancies, there's more and more science coming out as to why patients relapse after CAR-T and what we can do to try and mitigate the risks of this happening with novel techniques.
Yeah, and what I'm most excited about the whole thing is, especially as we organize the whole trainee session, one thing we all trainees need to face is first to understand what is going on, and that the field completely evolves within weeks or even days. Every day there is a new study in basic research, a new study in clinical research, and we trainees need to come up with this and to understand this, and that's why focus on the science behind it is very, very important, as I didn't really understand the whole thing 1 year ago, and I'm still learning every day about this when I treat patients. And the next one is, for me personally, very important is the management, the clinical management, because as we all know, the CAR-Ts are approved therapies with only phase 2 clinical trials. So we don't have control trials, large randomized control trials. So basically a provocative point, but maybe it's an experiment in the first years. And that's why we as trainees, we need to treat the complications, what is happening after we infuse the CAR-Ts. And that's where it's getting really interesting when people develop CRS and you basically have no clue what is going on. I now had a patient with ocular neurotoxicity, and even my chief didn't know what to do. And that's why I think there's very much to learn to understand complications and how to treat them. There are studies now out there also presented at this CAR-T meeting to prevent these complications with early treatment, maybe even before CAR-T infusion. I think that's a big point. We don't know yet for sure whether this really helps in the long term. And what Claire also mentioned is when we as trainees work in the clinic and people get admitted for CAR-T, stay for 2 weeks or even 10 days, and then we don't see them because we don't follow up them because we work in the clinic and not in the ambulatory setting. And what can we do to understand better when and how people will relapse after CAR-T? Because most of them do relapse. And to understand that, I think, is for me one of the most exciting things, because that's why we introduced CAR-T and are all very happy that it is there, because it prolongs survival and progression-free survival and relapse, but it doesn't cure most of the people. And to understand why it doesn't cure them, I think is a very, very large topic we need to understand more.